Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio, speaking with Mr. Edmundo Gonzalez this morning. He's CEO of Marpai Health. He's joining us to talk about bringing AI and deep learning to the self-insurance market. Welcome to Health Professional Radio, Mr. Gonzalez. Thanks for taking the time today.
Thank you. Delighted to be here.
Give us a bit of your professional background briefly and talk about your role there at Marpai, if you would.
So I am one of the co-founders of Marpai. My professional background has been in building technology companies in the last 10 years or so, mostly in the area of artificial intelligence and deep learning, which is one of the most advanced forms of artificial intelligence, or AI as we call it.
Now, before we talk a bit about AI and deep learning, explain to our listeners what the self-insurance space consists of.
Certainly. So a lot of companies, once they reach a certain scale in terms of the number of employees they have, they essentially have what's called an insurance pool. So from a risk perspective, they have a decision that's really quite simple, but the implementation is sometimes quite difficult. The decision is whether they go to a big insurance company and essentially buy health insurance for their employees. That means that they'll pay a fixed price, and that's a known price, on a monthly basis per employee. The other option is for them to self-insure, which means that instead of paying an insurance company, they are actually going to pay, dollar for dollar, all of their employees' healthcare costs. Mm-hmm. And in some instances, that scenario ends up saving employers a lot of money.
When you say paying all of their employees' healthcare costs, are we still talking about the employee contributing anything to fund that or something else?
Yeah. So generally, for the employee still, in many cases, it really depends on the employer, but the employer would also fund part of their healthcare costs, just like they would in a fully insured scenario. Mm-hmm. So for the employee, it may be similar, meaning they're still paying, say, $100 a month towards their healthcare coverage, but that is now basically a direct expense that the company is really taking ownership of. In other words, they don't have insurance like from Aetna or United Healthcare. They are actually responsible for paying those costs above what the employee would contribute. Now, there's one little nuance which makes this whole system actually work. So think of a small company that has, say, 150 employees. Okay. Well, if that company, for some reason, has 5 or 6 employees that all of a sudden have a very, very serious condition, let's say a very serious form of cancer, and those employees are going to cost about $1 million each. I'm exaggerating here for effect, but you get the point. Mm-hmm. So that relatively small company may go bankrupt, right? If it didn't have some kind of way to stop the loss from those high medical bills. So what happens is that there is a layer of insurance called stop loss. And these are some of the largest insurance companies in the world that will say, look, you go self-insured, you pay for all of your employees' healthcare costs, but if your entire expense is over a certain amount, let's say $3 million or whatever, you're insuring that away. So you'll never lose more than that. So the fact that there is stop-loss insurance really allows smaller businesses, businesses that are not Amazon or GM, to actually take advantage of the self-insured market. In other words, they can have a maximum amount that they're going to spend either on a per employee basis or even as a general pool of all of their employees. They can actually fix that amount and then buy insurance above that amount.
Where does Marpai come in, and where does IA and deep learning play a role in this payer-payee relationship?
Well, we started Marpai to really to do two things. First, we wanted to improve lives, save lives, and radically reduce the cost of healthcare in America. We're spending more than virtually every country on earth in healthcare on a per capita basis, and our outcomes are not, as good as one would think, being the number one spender. So we have a lot of work to do in the country. Now, our goal is to bring AI, and specifically deep learning, to give members, meaning the insured population, people like me, I'm insured with our own insurance plan, to give our members really a sneak peek into the future. This is what we can do with deep learning and with artificial intelligence. Now, what does that really mean? It means that we can tell which members of our employee population are potentially going to develop a chronic condition. Chronic conditions include diabetes, COPD, certain cardiovascular conditions. And we can tell that from all of their journey that we're mapping, meaning all of their historical claims, all of their historical visits, including their prescription drugs and other data. With that, we can map that journey and inform them whether they are at risk of developing some condition. This is very powerful because it allows both the employee, the member, and the employer essentially to get better health outcomes while saving money. I'll note that 2/3 of our healthcare costs generally are related to chronic conditions like diabetes, COPD, and cardiovascular issues.
So if I'm understanding correctly, you're predicting the potential illness and getting ahead of it, preparing as a company, or allowing your employee to prepare as well with that information?
Well, first of all, that's exactly right. So we're essentially predicting which members of our population will develop these conditions, and we're doing this in the near term, right? There's not much use in saying, well, Edmundo, you're gonna develop diabetes maybe in 20 years, right? That's a little bit out there. Our predictions really focus on conditions that are potentially developing in the next 12 months, which normally is the planned year for in healthcare, right? We kind of take a look at our health insurance once a year. Now, by doing that, we have a whole process called TopCare that basically reaches out to the member and educates them on their care options, right? So we're not healthcare providers. We are the payer, essentially. We're handling all of the healthcare costs, but we have the ability with AI to reach out to that member and say, hey, did you know you have a whole bunch of options that come with your plan? In many cases, it's really about going to see one's primary care physician, because a simple blood test may inform that physician, whether this member, this patient, it is on this journey, and then, of course, he or she can map out a plan of action. Really, what we want to do is prevent surprises. We want to prevent that member from ending up in the emergency room, in 6 months or 9 months, especially when a preventative action could be taken now. That's really what we do. Now, that benefits, obviously, the member's health, his well-being, but also it definitely impacts the overall cost for our employer clients. A visit to the ER may be well north of $10,000, where a visit to a PCP may be less than $100, right? So we really want to get that proactive action and empower that action on behalf of our members.
So basically leveraging the data, the stats, the claims, and overall health, you're getting ahead of these potential health issues with your employees.
That's exactly right. That's exactly right. We're getting ahead of these issues, and ahead of it, again, means months ahead. We really focused all of our models and our AI in predicting what we still consider near term. So near term is not tomorrow, but it's still within the next 12 months.
Give us a website where our listeners can learn more about Marpai Health.
Sure. So you can visit us at marpaihealth.com. There's videos and a lot of content there for both providers, obviously employers and members as well.
Great. And that website would be www.marpaihealth, marpaihealth.com. I thank you, Edmundo, for joining us here on Health Professional Radio this morning.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Mr. Edmundo Gonzalez, CEO of Marpai Health. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to our podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.